Today, we're talking about something incredibly important: the early signs of dementia, and, more importantly, what you can do about them. Whether it's you, a family member, or a friend, spotting the signs early can make a world of difference. So, let's jump right in with the 7 most important signs of early dementia and actionable steps to tackle them head on. First up, we have memory loss that disrupts daily life. Now, we all forget things sometimes, like where we left our keys or someone's name, but with early dementia, this forgetfulness is more persistent. People start forgetting important information, like appointments, recent events, or conversations, and may even ask the same questions over and over. This is a clear red flag. According to the Alzheimer's Association, memory loss is often one of the earliest and most recognizable signs of dementia. The key difference here is the frequency and severity of the forgetfulness. So, how can we tackle memory loss? One of the most effective ways is through brain stimulation exercises. Activities like puzzles, crosswords, and memory games can help keep the brain sharp. Studies published in the journal Neurology show that people who engage in mentally stimulating activities have a lower risk of cognitive decline. Another great option is to learn new skills, whether that's picking up a new language, learning an instrument, or even cooking a new recipe. The goal is to challenge the brain and keep it active. And don't forget the power of social interaction. Regular conversations and engagements with others can make a big difference. Next on the list is difficulty planning or solving problems. This is when someone starts struggling with tasks they used to do easily. Whether it's following a recipe or managing a budget, tasks that require concentration and focus become overwhelming. People may find it harder to make decisions, keep track of numbers, or solve puzzles that used to be simple. According to research from the Journal of the American Medical Association, JAMA, issues with executive function, like problem solving and planning, are early indicators of cognitive impairment. How do we address this? One of the best ways is to establish a clear routine and simplify tasks. Creating a structured daily schedule can help reduce confusion and stress. Break down tasks into smaller, more manageable steps. And don't be afraid to use tools like planners, to-do lists, and reminders on your phone. Cognitive behavioral therapy, CBT, is another effective approach, helping to teach coping strategies for managing complex tasks. Additionally, staying physically active has been shown to improve cognitive function. Activities like yoga or walking stimulate blood flow to the brain, supporting mental clarity. Our third sign to look out for is difficulty completing familiar tasks. These are tasks someone has done for years, like driving to a familiar location or operating the TV remote. Suddenly, these everyday activities become confusing or challenging. People might struggle to remember the steps or make mistakes they wouldn't normally make. According to research published in the Lancet Neurology, this often happens because the brain is having trouble accessing or processing old memories, a hallmark of dementia. So, how can we address this? Practice and repetition are key here. For people showing early signs, it's helpful to encourage them to go over familiar tasks regularly. Gentle repetition can reinforce neural pathways and keep these skills intact for longer. You can also simplify these tasks by breaking them down into smaller steps and offering gentle guidance if needed. In some cases, assistive technology, like simplified remote controls, GPS trackers, or voice-activated devices, can make daily activities easier. Occupational therapists can also work with individuals to find adaptive strategies that fit their specific needs. Confusion with time or place is another big sign of early dementia. People might lose track of dates, forget where they are, or not remember how they got there. This confusion can be unsettling, and it often leads to anxiety or frustration. Research from Alzheimer's Research and Therapy suggests that these disorientations happen because the brain's ability to process new information starts to slow down. It becomes harder to recognize patterns or retain details about the present. To help with time and place confusion, grounding techniques and visual cues are extremely effective. Grounding can be as simple as keeping a daily calendar visible or setting regular phone reminders to check the date and time. Using clocks, labeling rooms, or having a consistent routine can help minimize disorientation. Having a designated caregiver or loved one gently remind them where they are and what's happening in the present moment can also reduce anxiety. For those who tend to wander, wearing a location tracking device can add a layer of safety. Studies also show that staying hydrated and getting enough sleep can help stabilize mood and cognitive function. Fifth, we have difficulty understanding visual images and spatial relationships. This can show up in a variety of ways. People might have trouble reading, judging distances, or understanding the layout of a room. They might bump into furniture or have difficulty parking a car. A study published in the Journal of Cognitive Neuroscience suggests that spatial awareness declines as the brain's visual processing center is affected by dementia, making it harder to navigate and understand surroundings. How can we address this? Occupational therapy can work wonders for people dealing with spatial difficulties. Therapists can help individuals develop strategies to better navigate their environment and improve their motor skills. In addition to therapy, physical exercise is key to boosting spatial awareness. Activities like yoga, dancing, or Tai Chi can help improve balance, coordination, and spatial perception. Creating a clutter-free, well-lit environment at home also reduces the risk of falls and injuries. Large, clear signage or color-coded cues around the house can help people orient themselves better. Our sixth early sign is trouble with language. People may find it hard to follow or join in conversations. They might stop in the middle of a sentence or struggle to find the right word. Writing can also become difficult, with grammar errors or incomplete thoughts. According to a study published in Brain and Language, language difficulties are common in the early stages of dementia because the areas of the brain responsible for communication begin to decline. The good news is, speech therapy can make a significant difference for people experiencing language difficulties. Therapists work with individuals to practice word retrieval, pronunciation, and conversational skills. Reading aloud is another powerful tool, as it engages the brain's language centers and improves fluency. Additionally, encouraging the person to keep a word journal can help them track the words they struggle with, and gentle reminders to slow down when speaking can make communication easier. Keeping conversations simple, using short sentences, and allowing extra time for responses also go a long way. Last but not least, we have misplacing things and being unable to retrace steps. Everyone misplaces things from time to time, but in early dementia, this behavior becomes more frequent. People may place items in unusual locations, like putting the car keys in the fridge, and then be unable to remember where they put them or how to find them. According to the Alzheimer's Association, this is often linked to a decline in short-term memory and organizational skills. So, how can we prevent this? Establishing an organizational system can make a huge difference. Designate specific places for important items like keys, glasses, and wallets, and keep them there consistently. Visual reminders, like placing a sticky note by the door or using hooks for essentials, can help too. For more high-tech solutions, consider using item trackers like Bluetooth devices that can help you locate things with an app. Cognitive training and memory exercises can also help improve a person's ability to retrace their steps. Encouraging mindfulness during daily tasks and minimizing distractions can help the brain stay more focused on where things are placed. And there you have it, the 7 most important early signs of dementia and what you can do to tackle them. Remember, early intervention can make a big difference. So, if you notice these signs in yourself or a loved one, don't hesitate to seek help. If you found this video helpful, make sure to like and subscribe for more informative content. And as always, take care and stay healthy.